Hello. Thank you for joining us to learn about an exciting new benefit available beginning July 1st. Umicore has partnered with MDLIVE to pilot a telemedicine program, which gives you on-demand access to medical care, behavioral health care, and prescriptions as necessary for you and your covered dependents participating in our United Healthcare medical plans. Telemedicine is the delivery of health-related services and information by telecommunications technologies, including telephones and computers. Telemedicine allows you to have immediate access to licensed healthcare professionals for a lower copay than you pay on the 180 or 90/70 medical plans, and a lower payment to the provider for doctor's visits while covered on the 80/60 HSA plan. By using our new telemedicine program, you can avoid travel and wasted time in crowded waiting rooms and help yourself and Umicore lower health plan costs while receiving quality care. As a covered member on the United Healthcare medical plans, you do not have to leave the convenience of home or your workplace to speak with a licensed provider for a diagnosis and prescription. It's just that simple. By implementing MDLIVE, we want to accomplish two goals. We want to provide accessible, cost-effective care to you and your family members covered on the United Healthcare medical plans when you need it. This service through MDLIVE is available 24 hours a day, 7 days a week, 365 days a year, including holidays. We also want to work towards lowering our health plan costs. Remember, our claims are the driver to our healthcare premiums. MDLIVE makes healthcare for day-to-day issues that arise more affordable to all. 60% of Umicore emergency room visits are for non-emergency care, and that's because a lot of times emergency rooms are the only available resource on nights and weekends. The average cost for that emergency room visit for Umicore is $1,089, and of that, you pay around a $100 copay. Our urgent care visits have an average cost of about $125. On average, you pay about a $40 copay. And then visits to your traditional doctor, your primary care physician or your pediatrician, those have about a $101 average cost, of which you pay about a $20 copay. There's considerable time and money lost by employees and employers for unnecessary travel and wait times for medical appointments. While proper care may be necessary, the travel, the time away from work, the long waits, and the high cost of the visit can be avoided. You can choose to use MDLIVE for a more convenient and cost-effective alternative to the high cost of a visit to a doctor's office, urgent care facility, or the emergency room. MDLIVE can help reduce healthcare costs, maximize physician access, and offer convenience without sacrificing the quality of care. So what is MDLIVE? The service makes the care you receive accessible and convenient, and also ensures high quality and cost containment. MDLIVE is a privately held U.S.-based healthcare technology company. The technology allows you to have access to care 365 days a year by phone, video, or email from almost anywhere. MDLIVE has a national network of board-certified physicians and licensed therapists providing quality care through the convenience of the phone, the online video, or secure email consultations anytime, anywhere. The MDLIVE Vault is a secure portal for your health information where you enter your health history, like you do when you're a new patient at a doctor's office, for the doctor to review and make the best decisions about your care. When you enter your information into the portal, the attending physician then has access to help provide timely, informed care. When you allow your provider to view your health information, he or she can provide more informed medical advice tailored to your specific health needs. The MDLIVE healthcare providers have incorporated MDLIVE into their practices because they want to provide a cost-effective alternative to traditional care settings. MDLIVE doctors can diagnose, treat, and write prescriptions for routine medical conditions, and most importantly, it's private, secure, and confidential. The MDLIVE portal also has health references, symptom checkers, and an educational library that you may access at any time. MDLIVE lets you avoid long waits and significantly less cost than the emergency room or urgent care facilities and pay even lower copays than your medical plans. MDLIVE goes beyond the nurse line services of our healthcare plans because you can receive a medical diagnosis and receive prescriptions for non-controlled substances as necessary. You can also speak directly with licensed medical providers, including behavioral health therapists with an average of 15 years of experience. These doctors have specialized training in communication and diagnosing patients over the phone and through online video. One of the great benefits of having an MDLIVE plan is the availability of care when you are traveling and cannot get to your primary care physician. MDLIVE ensures you will automatically speak with a provider licensed in your home state or licensed in the state where you're traveling. Because by law, providers can only write prescriptions for the state in which they are licensed. If you are traveling out of state and may need a prescription, you will want to select a provider that is licensed in the state you have traveled to. Additionally, you must have a U.S. address and a U.S.-based phone number for the doctor to call back at the time of consultation. Although a medical consultation or behavioral health appointment is available internationally, prescription services are not. The entire U.S. is covered by MDLIVE for consultations and prescriptions, excluding Idaho. Prescriptions are not available in Idaho, only the consultations. As you can see from the map, most states have full service capabilities for phone and video consultations. Those in hot pink are for phone only. So who can use MDLIVE? If you and your family are covered on the Umicore health plans through United Healthcare, you are eligible to use MDLIVE beginning July 1st. When should you use MDLIVE? You should use MDLIVE if you're considering the emergency room or urgent care for a non-emergency medical issue. You should consider MDLIVE if your primary care physician is not available, to request prescriptions or get refills, traveling and in need of medical care, or during or after normal business hours, nights, weekends, and even holidays. You can use MDLIVE any time. What kind of conditions can be treated? Assistance with general health conditions for adults and children is offered. Such conditions include allergies, bronchitis, cold and flu, fevers, headaches, infections, pink eye, sinus infections, sore throat, ear infection. All of these can be treated through MDLIVE. Standard medical consultations take approximately 10 to 15 minutes, and most visits are completed within that time frame. The physician has the option to extend the visit at no additional charge. MDLIVE is designed to handle non-emergency medical issues. You should not use telemedicine if you are experiencing a medical emergency. You should dial 911 immediately. This service is not a replacement of your primary care physician. Your primary care physician is always the gatekeeper of your health. Not only are general medical conditions treatable through telemedicine, but also behavioral health conditions such as anxiety and depression, and a number of others through MDLIVE's licensed therapists and counselors. These therapy sessions run approximately an hour long. Let's talk about how it works. You have two options. You can call the toll-free number using your telephone, or you can schedule an appointment using the video conference by visiting the website. The MDLIVE service is active as soon as you register. You will need to activate your account and complete your health history before you schedule a visit. You can do this online or through the care coordinator. If you forget, you can simply call MDLIVE, speak to a care coordinator, and provide your health history over the phone. The care coordinator is part of the on-site medical trained health service call center that answers member health questions, takes personal health histories, and triages care. The service center is multilingual and TDD equipped. The average response time for MDLIVE is currently 20 minutes. However, members may experience a much quicker response time. If you dial by phone, you call the 1-800 number that's available 24/7, 365 days a year. You speak with the care coordinator who evaluates you and triages you to see if telemedicine is appropriate and redirects you to a doctor if so. Then you speak with the doctor. Once the doctor is available, MDLIVE system automatically calls and connects the doctor to you. By video conference, you would schedule your visit on the MDLIVE website by creating a user ID and password. The MDLIVE system helps the patient, you, determine if telemedicine is appropriate and helps you search a doctor by criteria such as specialty, language, gender, location, or simply find the next available doctor. Once scheduled, you can see a doctor online immediately, and you connect and the doctor connects to you through a portal, an online portal that is HIPAA compliant. Standard medical consultations take approximately 10 to 15 minutes, and most visits are completed within that time frame. The physician has the option to extend the visit at no additional charge. Once you've received care from the MDLIVE physician, you will receive discharge instructions from the provider by a patient portal, the MDLIVE Vault. You then have a personal health record with updated information that is passed along to the primary care physician that you designate for your patient file. All of this is done through MDLIVE Vault, the secure patient portal, and secure email. When you have a few moments, please log on to the WebMD site at mdlive.com/consumer/seeadoctor.html. Here you will watch a short 2-minute video from start to finish of seeing a doctor online. Most everyone has access to a smartphone with a data plan, like an Android or an iPhone. For those that do and are on the go, MDLIVE has a mobile app for the iPad, the iPhone, and Android to help you connect to a physician, complete the medical history, schedule appointments, send and receive secure messages, access lab tests and medical files, price transparency tools, which are knowing what the average cost of services are, and request prescription refills. The app allows you to do anything you would from your computer or by phone. This is a view of the app on your smartphone. It makes it so convenient to access care when you need it. I am sure you are wondering at this point what the service will cost you. There is no cost to sign up. You will only be charged a low copay when you choose to visit with a doctor or therapist. If you're in the 180 or the 90/70 plan, your copay for a medical visit is $8. If you're on the 180 or 90/70 plan and you would like a behavioral health consultation, that's a $20 copay and lasts about 60 minutes. If you're covered on the 80/60 PPO plan, which has the health savings account attached to it, it's a little different, and we have to follow the IRS rules to continue it as a qualified plan. You're responsible for the full charge on the consultation for medical and behavioral health. So your fee for the consultation for medical is $38, and your fee on the consultation for behavioral health is $76. All payments and copays are due at the time of service. You can pay by Visa, MasterCard, American Express, or Discovery. For your convenience, you may also use your flexible spending account card or health savings account card for the transaction. So what's next? You will receive a letter from Umicore announcing this new benefit shortly, followed by a package of information from MDLIVE that includes an ID card, a key fob, and frequently asked questions. This packet includes all the how-tos of this MDLIVE program. Make sure to put the card in your wallet, just as you do with your United Healthcare medical plan card. Go online and register yourself so when you need the service, you don't have to spend the time giving your health history. Next steps are using the service. The pilot will run through December 31st. If it accomplishes our original goals of providing convenient access of care with licensed physicians and helps Umicore reduce the current healthcare claim spend, we will add this benefit to our ongoing benefits package beginning January 1st permanently. Remember, this service is not intended to replace your primary care physician, but your primary care physician isn't always open or available. MDLIVE is. We encourage you to test this service out next time you or your dependents have a medical or behavioral health need. If you would like additional information before you've received your MDLIVE packet, you may access the Frequently Asked Questions section of the MDLIVE site at www.mdlive.com, or you can contact me, Jen Hargis, the Benefits Manager for US. Thank you for spending time with me today learning about this great new benefit, MDLIVE.